The Centers for Disease Control and Prevention warns that people, especially those with weakened immune systems, can develop invasive mold infections days to weeks after exposure to fungi that live in the environment. The agency advises physicians to keep invasive mold infections in mind when treating people who are sick after exposure to mold following a flood. People at elevated risk listed by the CDC include those who have had a transplant, have cancer, are undergoing cancer treatment, or are taking medications that weaken the immune system. The agency reminds medical professionals that the signs and symptoms of these infections can vary depending on the patient, the type of mold, and the part of the body affected, but often include the following: fever, cough, night sweats, weight loss, shortness of breath, sinus symptoms, and dark scabs, blisters, or ulcers on the skin. To help prevent invasive mold infections in immunocompromised people after a flood or other exposure to water damage and mold, CDC encourages medical professionals to talk with their patients about how to protect themselves. The agency cautions that mold grows where there is moisture, usually within 24 to 48 hours of flooding, and that even if mold is not visible, it is often present. Immunocompromised people are advised to not enter moldy buildings or to help clean up mold. These are just a few of the many things to know about invasive mold infections and potential exposure risks. To learn more about this or other indoor air quality, infection control, industrial hygiene, environmental health, or safety issues, please visit the website shown on the screen.
IAQ TV, the place to be.